Taking a break from cooking to talk with the newest orthopedic surgeon to join the orthopedic and sports medicine specialist team. I'm here with Dr. Douglas Miller. Good morning.
Good morning. Thank you for having me.
Thank you for being here. So first I got to ask you, what made you decide to become an orthopedic surgeon?
A lot of factors played into it, but some injuries through being a former athlete in high school led to my interest in it. But I think the ability to, with my hands and my brain, be able to help patients get back to a more functional, active lifestyle after musculoskeletal injuries, the reward that comes with that is what led me into orthopedics and a career in orthopedic surgery.
Let's talk about what actually is an orthopedic surgeon and what is your specialty?
So an orthopedic surgeon in general treats all musculoskeletal injuries, from sprains to broken bones to joint-related injuries. So we treat a wide variety of musculoskeletal injuries which limit people, but our main goal as an orthopedic surgeon is to get patients back on their feet, get them back to the active lifestyle that they want to live.
And you have a specialty in this area involving joint replacement and total joint replacement. So let's talk a little bit about that.
So my area of expertise and training was in total joint replacement, mainly anterior and posterior hip replacement, partial knee replacement, total knee replacement, as well as treating all the difficult revision total joint replacements. So the American Academy of Orthopedic Surgeons predicts that in 2030 there will be an increase in total knee and total hip replacements to almost over 1.2 million and over 600,000 respectively annually. So
wow.
With the younger population being more active, with the rise of the obesity epidemic, there's a lot of factors that go into play of why patients' joints are starting to wear out on them, and especially at an early age. So patients that we're seeing are starting to notice that they're getting more and more joint replacements at a younger age, as well as living longer, which leads to failures potentially of the total hip or the total knee replacements with time. So
but the good news is we've come so far, and you can do so much. So I've had friends that have had a lot of this stuff done, and they're back on the tennis court, living a full life. How do people know when they should see an orthopedic surgeon?
So the time to see an orthopedic surgeon would be when your pain becomes limiting to the things you want to do. If you're not able to get out on the tennis court, you're not able to go on your walks because your joint pain is functionally limiting you, that's the time to be seen by an orthopedic surgeon and to be fully evaluated for that joint pain. And there are multiple modalities which we can try before even discussing surgery that can help you get back on your feet without having to go to surgery. But at some point, the limitations and the reductions of quality of life that people are seeing will lead to joint replacement surgery, which is becoming more and more common these days.
Do you need a referral to see an orthopedic surgeon?
At OSMS, you don't need a referral. You can visit osmsgb.com, or you can just go ahead and call our office number, and one of our partners and surgeons would be happy to see you.
Well, welcome aboard, and thanks, doctor. Really appreciate it.
Thank you. Appreciate it.
Coming up, back to the kitchen to make another delicious recipe, so stay with us.